Mommy, I'm having sudden severe pain in my belly. My belly is also swollen, and I feel like vomiting too.
Have you been to the toilet today? This may be the reason you are having tummy pain. Drink plenty water to soften the poo so that you can go to the toilet. You should be fine once you empty your bowels. S1. No, Mummy.
Yes, Mommy, I will drink plenty of water as suggested.
Junior, how are you feeling now? Were you able to pass feces overnight and has the pain gone away?
No, Mummy. The pain is more intense and it's making it difficult to breathe. My body feels very hot and I have been shivering throughout the night. Can we please go see a doctor?
Yes, I think you have a fever too. I will take you to the emergency immediately after breakfast.
Mom takes Junior to the emergency and the doctor assesses him and orders X-ray and other tests.
Mrs. Spencer, your son's test results are out and we will have to take him to the theater for an emergency procedure.
The doctor explains the procedure to Mrs. Spencer and gets consent for the procedure. 20 minutes later, the doctor returns to the waiting area where Mrs. Spencer and her husband were waiting.
Mr. and Mrs. Spencer, I'm sorry we lost Junior before we could even commence the procedure. I am sorry for your loss. The test's results suggest that Junior's intestines were obstructed, which led to perforation of the intestine. Mr. and Mrs. Spencer, I am sorry we lost Junior before we could even commence the procedure. I am sorry for your loss. The test results suggest that Junior's intestines were obstructed, which led to perforation of the intestine. When this happens, air from the bowel enters the peritoneum and compresses the diaphragm, causing breathing difficulties. It can also lead to infection of the peritoneal cavity, which is the space where all abdominal organs are housed. About 70% of people with perforation and inflammation of the peritoneum are difficult to save. Unfortunately, your son was brought in very late.
Take-home message: sudden severe abdominal pain with abdominal bloating and fever may be a sign of bowel obstruction and perforation. Bowel perforation is life-threatening if not treated immediately. It is important that you get your child or family member to the emergency immediately if they experience sudden and severe abdominal pain, nausea and vomiting, fever, chills, or swelling and bloating of the abdomen. Take-home message: abdominal bloating and fever may be a sign of infection or disease. Seek immediate emergency care if you or your family member has these symptoms.